Hey everyone, it's Dr. Rida Khan. Welcome back to our channel Medico's Guide. Today, we are diving into a topic that affects millions worldwide. That is torticollis, also known as Rhineck. Whether you are a healthcare professional or someone dealing with this condition, stay tuned as we explore its causes, symptoms, treatment options, and much more. In this video, we will delve into various aspects of torticollis, including background, introduction, epidemiology, etiology, types, clinical picture, investigation, management, treatment, complication, red flags, and prognosis. Let's start with background. Torticollis, often referred to as wry-neck or cervical dystonia, is derived from a Latin word that is tortus, means twisted, and the collis means neck or collar. It is a medical condition characterized by involuntary contraction or spasm of the muscles of the neck, leading to an abnormal posture of the head and neck. This condition can significantly impact an individual's quality of life, causing discomfort and limiting movement. The mechanism of torticollis involves involuntary contraction or spasm of the muscles in the neck, leading to abnormal positioning or turning of the head. This can be caused by various factors that we will discuss later, such as muscular imbalances, trauma, neurological disorders, or structural abnormalities in the cervical spine. The exact mechanism may vary depending on the underlying cause of torticollis, but it typically involves disruption of the normal muscle coordination and control mechanisms responsible for maintaining proper head and neck alignment. And remember one thing, as it is asked multiple times, that always air is tilted towards the tight muscle and face and nose rotates to opposite side. Torticollis is a condition characterized by involuntary muscle spasms in the neck, causing the head to tilt or rotate abnormally. It can occur at any age, with congenital torticollis often seen in the newborns due to positioning in the womb or trauma during birth. Acquired forms can result from muscle spasm, injury, inflammation, or underlying medical conditions like cervical dystonia. The prevalence of torticollis varies across populations, with estimates suggesting that congenital torticollis affects approximately 0.3% to 2% of newborns. However, the acquired forms of torticollis can occur in individuals of all ages with varying degrees of severity. Etiology or causes. Causes of torticollis can be diverse and may include congenital factors such as abnormal positioning in the womb or trauma during birth. CMT, that is congenital muscular torticollis, is the most common cause, and it results from shortening and fibrosis of SCM, that is sternocleidomastoid muscle. Acquired torticollis typically occurs after 4 to 6 months. It may result from muscle injury, inflammation, or cervical nerve irritation. Muscular or skeletal abnormalities are the result of injury or trauma to the neck muscles. Infection or inflammation of cervical spine can also contribute. Neurological conditions like cervical dystonia, brainstem lesions, or certain genetic disorders can also play their role. And other causes are rare and they can include cervical spine malformations, Chiari malformations, or spina bifida. Understanding the underlying cause of torticollis is crucial for determining the most appropriate treatment approach. Now, let's discuss the types. So, torticollis can be classified into several types based on its underlying cause and presentation. Some of the most common types include number 1, congenital torticollis, and this type of torticollis is present at birth and is often attributed to factors such as abnormal positioning in the womb or trauma during delivery. It is typically characterized by tightness or shortening of sternocleidomastoid muscle in the neck. Acquired torticollis. Acquired torticollis develops after birth and it can be caused by various factors such as injury, inflammation, infection, or underlying medical conditions like cervical dystonia or neurological disorders. Muscular torticollis. Muscular torticollis, also known as idiopathic or spasmodic torticollis. It involves involuntary muscle spasms or contractions in the neck, leading to abnormal head positioning, and it may result from muscular imbalances, strain, or overuse of the neck muscles. Now let's discuss about cervical dystonia in a bit detail. So first of all, we have the definition, that is cervical dystonia is also referred to as spasmodic torticollis, and it's a neurological disorder characterized by sustained muscle contractions in the neck, causing involuntary movements and abnormal postures of head and neck. The cause. Now, the exact cause is unknown but believed to involve abnormal signaling in the basal ganglia of the brain. Symptoms. So, the symptoms include abnormal head movements, postures such as twisting, tilting, and turning of the head. Chronicity. It tends to be a chronic condition with symptoms often worsening over time. Now, the management includes medication, botulinum toxin injections, physical therapy, and in some cases surgery to alleviate symptoms and improve quality of life. Now, secondary torticollis. It occurs as a result of underlying medical conditions or factors such as trauma, infection, tumors, or structural abnormalities affecting the cervical spine or surrounding tissues. Positional torticollis. It often occurs in infants and is attributed to prolonged or repetitive positioning of the head in a particular direction, leading to the muscle tightness and asymmetric head shape. Now, fixed torticollis involves permanent structural changes in the cervical spine or soft tissues, leading to persistent head tilt or rotation. It may result from congenital anomalies, traumatic injuries, or degenerative conditions. Now let's discuss about iatrogenic torticollis in a bit detail. So first of all, it is defined as a torticollis that is caused by medical interventions or treatments. So it can result from procedures such as surgery, injections, or other medical interventions affecting the neck muscles or nerves. And typically, these are temporary and resolves once the underlying cause or trigger factor is addressed. Now, the management. Treatment focuses on addressing the underlying cause or complication resulting from the medical intervention. Now, each type of torticollis may require different approaches to diagnosis and management, highlighting the importance of identifying the underlying cause and tailoring treatment accordingly. Now, let's talk about signs and symptoms of torticollis. Individuals may experience a tilted head, rotation of chin towards one shoulder, pain, stiffness, or tightness in the neck muscles, limited range of motion, pain or discomfort in the neck, shoulder, or upper back, headaches or migraines, especially if associated with cervical dystonia. And these symptoms can be debilitating and impact daily activities. When it comes to management and treatment, options vary depending on individual's age, health status, and severity of the condition. Physical therapy, medications, neck braces, and in some cases, surgical intervention may be recommended to alleviate symptoms and improve neck function. So, in the physical therapy, it can include stretching exercises, massage, and other therapeutic techniques, and this can help relax tight muscles and improve range of motion. Now, the medications such as muscle relaxants, anticholinergics, anti seizure medication, pain relievers, botulinum toxin injections may be prescribed to reduce muscle spasms and alleviate discomfort. Neck braces or supports. These devices can help support the head and neck in a more neutral position, promoting proper alignment and reducing strain on the muscles. Surgical intervention. In severe cases or when conservative measures fail to provide relief, surgical procedures such as selective peripheral denervation or deep brain stimulation may be considered. Now, the torticollis is associated with infection and inflammation, then the management includes antibiotics, rest, anti-inflammatory medications such as ibuprofen, passive motion, and surgery if indicated. Now, if the etiology is trauma or sleeping posture, then the muscle relaxants, passive motion, soft collar or brace are indicated. Now, the self-care measures may include heat compress. For it, dip a small towel in a hot water and place it over a painful area. Gently massage the affected neck muscles. Consider using neck braces, especially while driving, and prevent abrupt movements of the neck. Moving on to diagnosis and investigation, typically a thorough evaluation is conducted, including a medical history, physical examination, and diagnostic tests such as imaging studies and electromyography, that is EMG, to identify the underlying cause and guide treatment decisions. Imaging studies such as X-rays, CT scans, MRI scans, and ultrasonography may be performed to assess structural integrity of cervical spine and identify any abnormalities. Electromyography (EMG). This test measures the electrical activity of muscles and can help diagnose underlying neurological conditions contributing to torticollis. A thorough diagnostic workup is essential for identifying the underlying cause of torticollis and guiding appropriate treatment decisions. Now, let's take a look at complications. Torticollis, although primarily characterized by involuntary contractions or spasm of neck muscles leading to abnormal head and neck positioning, can potentially lead to various complications if left untreated or poorly managed. Here are some complications associated with torticollis. Musculoskeletal issues. Prolonged torticollis can lead to musculoskeletal problems such as muscle stiffness, weakness, and imbalance. This can further exacerbate neck pain and limit the range of motion in the affected area. Postural abnormalities. Persistent torticollis can result in postural abnormalities where the individual may adopt compensatory positions to accommodate the tilted or rotatory head. Over time, this can lead to chronic postural issues affecting the spine and other areas of the body. Neurological conditions. This can occur due to nerve impingement by contracted muscle. Developmental delays. Torticollis in infants, particularly if left untreated, can interfere with normal developmental milestones such as head control, crawling, and walking. Delayed motor development may occur as a result of limited neck mobility and muscle weakness. Now, plagiocephaly. Positional plagiocephaly, characterized by a flat spot on the head, can develop in infants with torticollis due to prolonged pressure on one side of the skull. This may require corrective measures such as repositioning techniques or helmet therapy to reshape the head. Functional limitations. Severe cases of the torticollis can significantly impair daily functioning, affecting activities such as driving, working at a computer, and participating in recreational activities. The limited range of motion and pain associated with torticollis may interfere with various aspects of life. Secondary injuries. Individuals with torticollis may be at an increased risk of secondary injuries due to impaired balance and coordination. Falls, accidents, and muscle strains may occur as a result of altered movement patterns and reduced stability. Cervical dystonia. In some cases, torticollis may progress to cervical dystonia, a neurological disorder that is characterized by sustained muscle contractions, causing abnormal postures and repetitive movements of the head and neck. This condition can be more challenging to manage and may require specialized treatment approaches. Psychological impact. Chronic pain, discomfort, and self consciousness resulting from torticollis can have psychological implications, leading to decreased self esteem, anxiety, and depression, especially in the adolescents and adults. Moreover, babies with torticollis may experience difficulty breastfeeding on one side and prefer one breast over the other. They may also work hard to turn towards their caregivers, resulting in discomfort and limited mobility. Some infants with torticollis may develop positional plagiocephaly, a flat spot on the head, from lying in one position or one direction most of the time. Additionally, the neck joint face may appear uneven and a small neck lump and bump may develop, resembling a knot in a tense muscle. However, these issues often resolve as torticollis improves. It's essential for individuals with torticollis to seek prompt medical attention and adhere to a comprehensive treatment plan to prevent or minimize the risk of complications. Early intervention, physical therapy, medications, and other therapeutic interventions can help improve symptoms, enhance neck mobility, and prevent long term sequelae associated with torticollis. So, what can parents do to help their baby with torticollis? Here are some exercises and tips to try. Number 1. Encourage turning during feeding. If breastfeeding, offer a breast in that way that encourages the baby to turn away from the favorite side. This can help stretch the neck muscles and promote more balanced feeding. Positioning during sleep. When putting a baby down to sleep, positioning them to face the wall. Babies naturally prefer to look out onto the room, so they will actively turn away from the wall, stretching the tightened muscles of the neck. Remember to always place the babies on their back to sleep to reduce the risk of sits. Encourage turning during play. During playtime, use toys and sounds to draw your baby's attention and encourage them to turn in both directions. This can help promote balanced muscle development and improve neck mobility over time. Red flags. Seek immediate medical attention when you observe one of the following points. Number 1. Neck stiffness or inability to extend neck. Fever, drooling, or vomiting. Increasing or unremitting pain. Recent trauma. Gait disturbance. History of headaches or behavioral changes. Life-threatening causes, that is retropharyngeal abscess, spinal epidural hematoma, and CNS tumors. Now, let's address an important aspect, prognosis. With early intervention and proper management, many individuals with torticollis can experience significant improvement in symptoms and quality of life. However, some may require ongoing treatment and monitoring to manage chronic or recurrent symptoms effectively. In conclusion, torticollis is a complex medical condition that can have a significant impact on individuals' well being. By understanding its causes, symptoms, and treatment options, healthcare providers can work collaboratively with patients to develop personalized care plans aimed at optimizing outcomes and improving quality of life. Stay informed, stay proactive, and remember that early intervention is a key to effectively managing torticollis and minimizing its impact on daily life. And that's all from today's video. Thank you for tuning in. Don't forget to like, share, and subscribe for more helpful content. Remember, you are not alone in this journey. Together, we can support our little ones and help them thrive. Take care, and we'll see you next time.